name's Megan. I'm going to be doing my central line pass-off video. I'm going to begin by reviewing the order for this procedure, and then I will apply hand hygiene and gather my supplies. So, hi Mr. Smith, my name's Megan. I'll be your nurse today. I'm going to be flushing and changing your dressing, your central line. And so it's a painless procedure. It's just sterile, so I'm going to have you wear a mask. So just put this here. Okay. Can you verify your name and date of birth? Just check that, okay? And apply hand hygiene always. And I'll close the curtains for privacy. Okay. So I'm just going to raise this up. Then I'm just going to raise your head up a little bit. Okay. Then I'm also going to put on a mask, but for the purpose of this video, I'm not going to. Just put it on the patient. Okay, there we go. Okay, I'm going to put some clean gloves on. Alright, I'm just going to pull this down a little bit. Okay, I'm just going to first assess his dressing, look for any redness, or I'm going to palpate it a little bit. Does that hurt? Any tenderness or drainage or anything? It looks good, so I'm going to proceed with this. Okay, we'll open that in just a second. I'm going to go ahead and remove this. So I just want to make sure not to pull the skin, so I'm going to pull the skin down and pull this up. Patient, and I want to make sure that stays in there too. So I'm going to note the length of the central line too. Okay. All right. So I'll perform hand hygiene again. Okay, if there was any like crusties or anything, I would use these to kind of clean off the area, but it looks good for now. Open this up and being aware of my 1-inch borders. I want to open this away from me. Just very carefully. Okay, I'm now going to apply sterile gloves. Okay, I'm going to start with my non-dominant hand first. Just being very careful not to touch the other one. I'll fix that in a second. And I'm going to carefully pick that up. So I would have done it differently, but okay. I don't want that to get... You know, at this point I would just start with some new gloves. So let's just start over. For this purpose of the video, I'm just going to use these same gloves. So I'm going to fold that. Okay, so I'm going to get some new sterile gloves after performing hand hygiene. Now carefully open it. Okay, and then with my non-dominant hand, I'm going to on the sterile glove. Okay, now my hands are sterile. And I'm going to start by cleaning this chlorhexidine, break this, and then I can clean that. That can just help me kind of lift that up a little bit. Okay, so I'm going to clean under it and all around, making sure not to touch anywhere. And I'm going to allow that to completely air dry. And then there, I would take Q-tips if there's any other place I needed to clean. Once that's completely air dried, I'm going to apply the barrier film. Threw that away. So yeah, I applied the barrier film. And then I'm going to place the disc here. And now I can go ahead and apply the dressing. I just want to make sure there's like as less wrinkles as I can. Okay. All right, and now I can date and initial the time and date and my initials on his dressing as well. And then I'm going to now flush it so I can clear my table. And I'm going to All right, Mr. Smith, I'm back. I'm gonna just flush your catheter here. Okay. So I'm going to remove the hub, clean it. Scrub the hub. I'm gonna let that air dry. Okay, and then I'm gonna go ahead and flush a little bit. And then I'm gonna pull it back, make sure that there's some blood flow, and then I'm gonna flush the rest of it using a pulsatile technique. Okay. And so make sure that's clamped. And then I can take that off and I'm gonna apply a new hub. For the purpose of this video, I'm gonna just be applying the old hub, but this would be a brand new hub. And I would repeat the process as needed for the other ones. And then I'm just gonna cover them back up and get them in a comfortable position and document my procedure and clean up. Thank you.